The first time I came across the word crepitus was when we were under the cardiology unit in the hospital. So when we were under the cardiology unit in the hospital, when we are like checking out for a patient that has asthma or any respiratory airway problems, there's usually this sound when they are breathing in. When they put the stethoscope, they tell them breathing, all right. And when the sound is crunching and all of that, like crushing leaves that are dried, that's what they call crepitus. All right. So in orthopedics too, if your joints are like inflamed or if there's any problems with your joints, sometimes you might have some abnormal sounds like that. Okay, when you move the joint, and this is what is known as what joint crepitus. Okay, so joint crepitus, also known as what noisy joints. Your joints are making some sounds. Okay, so this is a thing that is seen in some conditions, right? So we'll talk about it, we'll discuss it. Then look at the possible causes. What could make your joints make some noise? Then when to seek medical attention. Then what are the common conditions that are associated with what joint crepitus, which is basically the most important part of this lecture. Okay. So for the definition, we say that this joint crepitus, they refer to what? A crunching, popping, or grinding sounds that occurs when your joints move. Okay. So these sounds can be accompanied by a sensation of pressure being released within the joint. Okay. So crepitus is common and can happen in various joints such as the knees, the shoulders, and knuckles. Okay. So what are the causes? It could be that your joints are stiff. So pressure builds up within the joint when moved. Okay. So tiny gas bubbles form and burst, causing a popping sound. Okay. It could be loose joints. Okay. So joints are not held securely. These joints, these loose joints now, they are not held securely in place, right? And this can partially dislocate or move out of place, right? And this can lead to what? Crepitus, okay? Bone rubbing. In conditions like arthritis, bones may rub against each other due to damage or degenerated what? Cartilage, okay? Tendon or ligament snapping, okay? Tendons or ligaments can move over what? Bony surfaces, okay? And this can actually cause sound, okay? Okay, when to seek medical attention, this is basically for patients if there's pain or discomfort. If crepitus is accompanied by pain, swelling, or difficulties moving the joint, it could actually indicate that there's a problem. So you see your doctor. For persistent symptoms, if the sounds and sensations are frequent and persistent, it's a good idea to what? See a healthcare provider, right? So what are the common conditions associated with this crepitus? It could be osteoarthritis, and this is due to what? Bones rubbing against each other. All right. It could be tendonitis. This is inflammation of the tendons. It could be meniscal tears. All right. It's tears in either the medial meniscus or the lateral meniscus. Right. It could be Baker's cyst, which is a fluid-filled cyst behind the knee. Okay. So this is what joint crepitus or noisy joints. Basically, the definition, the causes, and conditions associated with crepitus.